Hi, Josh. I'm a pharmacist with pharmacisttips.com, here to tell you about Benazepril HCL, the 20 milligram dosage cough that can occur with this medication and some of the other side effects that we may see. There'll be a summary of this information at pharmacisttips.com/Benazepril. What is Benazepril? It's a ACE inhibitor. ACE inhibitors cause, the main effect they have is they cause the blood vessels in the body to relax. They can also have some effects on electrolytes like sodium and potassium, but the main effect we're looking for is a blood vessel relaxation. In the US, it's sold under the brand name Lotensin or Lotensin HCT. The HCT has a water pill or a diuretic mixed in with it. Again, it's used to treat high blood pressure. It may be used in combination with other blood pressure medications to provide a synergistic effect to bring that blood pressure. Benazepril dosage varies depending on how high the blood pressure is. It can be taken with or without food, but we do want to try to take it at the same time each day, so we provide a 24-hour coverage of blood pressure control. Typical starting dose around 10 milligrams a day. It is available in 5, 10, 20, and 40 milligram tablets, and there's a combination with hydrochlorothiazide available in 4 different strengths as well. Typically, we kind of see the ceiling dose around 80 milligrams a day, and when you're on that higher dose, that's will most likely be split up into twice a day or every 12-hour dosing, depending on what your doctor decides. So some of the side effects of Benazepril, common, we see a dry cough. That can happen with all the ACE inhibitors. The medicine will need to be switched if that is the cause of it. Many people just describe it as a constant tickle in the back of the throat. We can also see some drowsiness and dizziness. That can happen with any blood pressure medication. Sometimes if it works too well and brings our blood pressure a little too low, we can feel like that. You'll want to monitor your blood pressure, let your doctor know if you're having problems with that, especially if when you're sitting and you stand up, if you get lightheaded, that's something your doctor needs to know about. This can raise potassium in the body, so we're going to want to watch certain salt substitutes and not increase the amount of potassium that we're taking in our diet. This will be monitored with labs most likely, and you can ask your doctor if you're concerned about your potassium getting too high. Rash can occur, and nausea and vomiting, as well as others. But on a whole, we do see Benazepril tolerated really well by most people. Some of the more rare and serious side effects include birth defects. So this medicine is never used during pregnancy. If you're on it and you become pregnant, you want to contact your healthcare provider immediately. A serious side effect called angioedema, where we can get swelling in the face and the neck. That would require immediate medical attention. Sometimes it can cause kidney problems or liver problems, or rarely a severe rash. Any of those occur, of course, you'd always want to get medical attention right away. I appreciate you watching this video, and if you like the information, I'd love it if you'd subscribe to my channel. Be sure you always contact a healthcare provider if you have questions, concerns, you feel like you're maybe having side effects or interactions. You want to let them know right away. The sooner they get that checked into, the less likely it's going to have continuing problems for you. I appreciate you watching. Again, a summary at pharmacisttips.com/Benazepril.